Hi, this is Peter Hinssen, and welcome to this rendition of The Day After Tomorrow, talking about healthcare and disruption, and talking about what is actually next. We've been talking about evolution in healthcare for a very long time. We've been talking about disruption. This is an interesting year because 2019 is actually the year of Blade Runner, and some of you might remember some of these amazing images from that wonderful movie from 1982. And the original Blade Runner 1982 actually set in 2019. And what is ironic is that in 2019, when we have finally arrived, we actually don't have the flying cars, and we don't have the replicas. So there's something about technologists that have an extreme capability of actually predicting the future that never happens. So when you look at it, we're in an environment where innovation is now the general theme of almost every single industry, almost every single company out there. Innovation is the normal game of operation. I'm getting a little bit tired of the technology unicorn, these fabled, imaginary, wonderful tech companies that grow so quickly. We can't all be unicorns. Instead, I've become hugely into another mythical animal, the phoenix, which is, I think, a much more interesting mythical animal, which is companies that can reinvent itself, even under stress. And I think instead of focusing on the unicorns, maybe we should focus exactly on companies and trying to reinvent ourselves. And in this light of disruption, which is, I think, something that we see happening in many, many markets, the most important capability of organizations is not to implement technology, but the willingness to change, and more than else, the ability to actually really make a difference. And are we living in times of fundamental change? I think we are. We're seeing that sometimes more often in our personal environment than in our work environment, but just look at your personal context, your home environment, your family, and how much that has changed in the last 5, 10, 15 years. We see a radical transformation. We talk about disruption when it comes to what it means for markets and different industries. And I believe that we are at a crossroads. We're at a crossroads in many, many markets where we see, for example, technology and economy colliding with new players that are changing the game, that are changing the rules, are rewriting the rules of how certain economies actually play out. We're at a crossroads where, for the first time, we now see that technology and politics, for example, are completely intertwined. This is one of my favorite images. The moment that Donald Trump was president-elect, he called his best buddy in Silicon Valley, Peter Thiel, the co-founder of PayPal, to gather the meeting of the minds, the captains of industry of Silicon Valley. And of course, we all know that maybe the election of Donald Trump was even influenced by technology and by social media. We're at a crossroads where we see technology and geopolitics coming together. Look at the Cold War that is brewing between the US and China. The arrest of the CFO of Huawei in Vancouver not too long ago, which is, in my opinion, the beginning of a really strange episode into this new Cold War. And of course, we're at a crossroads where technology and biology are coming together. End of 2018, maybe the most interesting thing that happened in the healthcare industry, the birth of 2 controversial babies that were modified by CRISPR-Cas9. And of course, the beginning of a fundamental new chapter in the world of healthcare. So, crossroads. And I believe that this is just the beginning. We're in a warm-up phase where we're going to see an acceleration. And the big question is that really helping? Is that really making progress? Are we in a situation where these things actually are working towards a goal, and are we really transforming and making progress? So let's take a look at that in this webinar. That we are in fast-changing times needs no introduction. In many, many aspects of how technology has been influencing our lives, we've begun to see that. And sometimes we overestimate, sometimes we underestimate that. The cover of Time magazine in October 2007, and then the same cover in October 2007, but Forbes magazine with a completely different perspective shows that we have to be alert and that we have to be open-minded. But this is the world that we're now getting used to. I wrote a book a few years ago called The New Normal, What Happens When Digital Becomes the New Normal, where that's something that was special just a few years ago. We're now in an environment where we're never offline, we're constantly connected, and we're seeing that because it has become a societal element. In every single aspect of our lives, digital truly has become the new normal. But what are the new normals today? And I've done some research and looked at a number of trends and technologies where you can look at what the current state of new normal is. And I don't think there is one new normal. I think we're now in an environment where there are multiple new normals. And what you see here is a number of things that I've picked up. Cloud has become the new normal. Agile, in the way that we've gone from waterfall to agile development, has become the new normal. When you look at cyber or connections and APIs, when you look at mobile, big data, social and digital marketing, I would argue that this is not new anymore. This is the new normals, plural. And the reason is very simple, because any startup out there that is starting and competing with you is going to use this as the ground zero. This is their baseline. This is where they start from. This is their normal mode of operation. And if you're not up to those new normals, you're actually behind. You're catching up. So I think we're constantly in a situation where we have to be open-minded for what the new normals actually are. And we might be getting into a situation of the never normal. It's an increasing acceleration of new technologies, new concepts, and new ideas that are giving us a situation with more and more new normals, and actually arriving at a situation of constant flux, which is the never normal. So how do you prepare for that? When we talk about disruption, it's very clear now that disruption is not technology, which we thought a few years ago. You just use new technologies and figure out what it means in a changing environment. No, this disruption might be more of a viral thing. And when you look at that virality, it's not just that we have technology and networks changing economy. That's the fundamental flux of business models. We see that technology is changing business models, and economy at the same time is changing society and societal trends. It's that constant flux that we have to be mindful of. Of course, being a technologist, a caveat, technologists are the worst to predict the future. I still love the statement from Bill Gates, 20 years old, when he was asked to say something visionary, and he said, eventually everyone's business card will have an email address on it. We're now entering a world where I think it's a combination of technologies that are accelerating the pace of change. And if you look at that cocktail, I believe it's four things that are fundamental. We're in an environment now where more and more we see that ecosystems, networks, and the way that networks are changing economic models, the platform idea is one of the big fundamental changes that we have in every single industry. At the same time, combined with data, we've talked about big data and analytics for a long time, but we now see the raw power of data, and then we turn that into intelligence, and then we combine that with automation. And I think that provides the powerful cocktail. So let me briefly talk about the platforms. And when you look at the platform economy and what that means, we've started to understand that this might be the beginning of a new fundamental way we think about some economic models. Now, some of these platforms, some of these new business models using ecosystems have used the power of these positive feedback loops to become very dominant and, create something that we call category kings. And category kings are winner takes all in that 21st century new game. When you look at some of these category kings, and I have a couple of them on the slide here, you begin to understand that they have grown very quickly because of positive feedback loops. They are a very dominant factor in their market. And I take the example of Android. 83% of the world population uses an Android smartphone. And last year, the European Commission gave Google a €5 billion fine. Margrethe Vestager, the European Commissioner for Competition, said that this was an unfair economy of scale and it was an unfair advantage. But what if this is actually the new normal? If you look at the way that these companies can attract capital, or that they can actually muster up inventory, or they can connect to a user base, and let's be honest, why would I join another social network if all my friends are on Facebook? We're seeing that whether this is brand or capacity or convenience or reach, we see that these new ecosystems build platforms very, very quickly, become category king, and they are attracting users like magnets. And we, as consumers, are responsible for that because we are feeding data to these beasts. And in the beginning, these beasts are, very nice and friendly. I use Waze as an example. Waze is probably one of my favorite platforms out there. I couldn't survive without Waze. It is very simple. I give it information. They become smart. They become intelligent. They become more clever. And they grow and they give me value in return because I get to where I have to be exactly on time. And as I said, we are responsible for that because we as consumers, we're feeding the beast. In the beginning, these beasts are nice and warm and cuddly. And after a certain moment, we give them too much information. We feed them too much data, and then they turn into these horrible monsters that we have to give €5 billion fines. But what if this is not an anomaly, but this is a new 21st century reality? And I think this is some of the big questions we have to ponder upon, because we're seeing that they have huge impact, say, in mobility. We're seeing that they have huge impact in things like e-commerce. But what if they also become a dominant factor in the world of healthcare? And of course, some of these platforms are not undisputed. Let's be honest, 2018 was an annus horribilis for a platform like Facebook. The questioning of Mark Zuckerberg by the American Senate was a really good example of that. The stupidity of the questions was hallucinating. But let's be honest, we're seeing that this might be a sign of a complete disconnect between politics and technology. Just end of 2018, again in the Senate, the American Senate was asking the CEO of Google why, if you type in idiot in Google, a picture of Donald Trump arrives. I think we're onto something here. There might be a complete disconnect between political leadership and technological competence. What is clear is that these new platforms actually generate a new mechanism that commoditize industries very, very quickly. We call it the dumb pipe syndrome. Taking from the telco sector, where 10 years ago you would connect and it would be important for you, you would still need them. The telco was essential and they were also relevant. But what happens now is that we are actually connecting people, but all the value is captured by the players over the top, these new platform players. And the telcos have been reduced to a commodity. They were essential and relevant. They're still essential, but they are no longer relevant. And I think this is a mechanism that we see in many of these dynamics when playing out into the platform economy. You have a value-added provider that has both relevance and is essential. And once they become commodities, we have that dumb pipe syndrome. And then you can do two things. You can really innovate and think about what your added value as a platform is, or you could just become a bigger dumb pipe. But that is no recipe for success. If you look at what is happening in that broader platform scale, everybody, of course, is eyeing Amazon. Amazon, the most interesting company in the world in terms of economics, sales keep growing exponentially. And in 2018, even a small profit for Amazon, which was as much as a surprise for anyone else as for Amazon itself. But the result, of course, is that Amazon, with its continued focus on long-term thinking and leveraging the platform to the extreme, is now basically ripping apart the world of retail. Here's the obvious icon that went belly up in 2018. It was the original Amazon, if you will. They invented the catalog, and when it went bankrupt in 2018, my favorite headline was Tears for Sears. But then, of course, I grew up in the 1980s. But we see the same thing happening over again. Value-added provider, essential and relevant, and then becoming commoditized into this dumb pipe. And then you can do things. You can innovate, or you can become a bigger dumb pipe, but no recipe for success. Is this going to happen in the world of healthcare? We're seeing the very first tremors of that. And of course, Amazon has done very little so far. I mean, buying PillPack was just a little introduction, but we're seeing now that the type of movements that we have in the broader healthcare industry is a preparation for the fact that these new players, these ecosystems, these platforms are gearing up. And once they do, it can happen really, really quickly. So the obvious thing is to say this is no good. We should do something about this. We should stop these new players from disrupting entire industries because these new players have become too dominant, just as we've done in the past with, for example, the Standard Oil Company. Standard Oil Company having a monopoly on oil and then the US government shutting them down because it's the only thing that could happen. I honestly believe that this will not happen for the very simple reason is that we're now seeing that this has become a geopolitical game, and it will be foolish for the US government to shut down these players because they might be essential to keep that economy in good shape. So no Standard Oil Company recipes here. What is very clear is that these companies rely on one essential ingredient, and that is, of course, data. And there's a lot of dispute about that. The capacity of these companies to mine the raw potential of information and to gradually turn that into value. And of course, it's not fair because it's free. And I think this is an interesting thing. We're seeing that these new players rely on massive amounts of data because that's the only way for them to actually gather intelligence. And in return, they try to provide these types of services at a very low cost or free. As you know, Google is paying Apple billions of dollars a year just to keep the search of Google as a free app on the Apple product. And if you look at that, it's really a situation where we're convinced that everybody is now in the information business, healthcare included. Of course, everybody is conscious that we have to understand more about consumers. We have to understand and zoom in on the individual. But of course, in the concept of patients, we say, privacy, we have to be very mindful of privacy. I'm honestly a believer that privacy is an extremely elastic concept and that we're going to see that elasticity played out. My favorite story of 2018 was the Roomba robots, and some of you might have one of these amazing little devices in your house that cleans the house and mops the floor. It turns out that maybe they're secretly mapping the floor plan of your house, seeing where the cupboards are, and maybe secretly selling that to IKEA to give you an indication of what other shelves or opportunities there are for IKEA to invade your house. The bottom line is very simple. We are in a game where information is now the game. We're trying to turn that into value, and some of these players are starting to really understand that. Look at Google. If you look at Google, 1 out of 20 searches on Google is health related, which basically makes the search engine the longest running clinical trial in the world. You say, wow, that's not really true. But if you look at it, we're seeing that more and more people are using these mechanisms to find information once they might be afflicted or think that they might be afflicted by a certain disease. I take Lyme disease as an example. I love that example. We were at Google last year, and they showed us the example that Lyme disease is notoriously difficult for physicians to actually diagnose. But now with these carts that if you search on a particular disease in Google, you have at the right-hand side the information about the disease, you have information about diagnosis, you might see the symptoms, you might see the treatments. But the interesting thing about Lyme disease is that Google often knows quicker than a physician that you might be suffering from Lyme disease, because not only does Google see you searching for these symptoms, but they know with your Android mobile that you've been in a forest in the last couple of days, a forest which might have the ticks that spread Lyme disease. And actually, it's a great example of Google being able to diagnose or see things earlier than a physician. And that's just based on behavior, surfing, and location data. Imagine what we would have if Google would actually have access to more data, or the Apples with their health kit, for example. We're now seeing that this is going to be turned into economics. It's not just about healthcare, but look at insurance. We're seeing now that how you behave, what you do is going to be taken into account and is going to be transformed into the raw economics of actually delivering you the type of treatment that you absolutely need. What is important, and I think this is crucial, is that in this world of information, it's all about one thing. It's about being able to really provide trust to the individual. And the technologies there are still quite, I would call, embryonic, but we're in an environment where this is going to be the number one thing. How do we provide trust for a world where information becomes a commodity? Even in genetics. I mean, the father of synthetic biology, George Church, last year launched a company, Nebula Genomics, which is capable of storing your genome into a blockchain, which is then going to be your genetic passport for the rest of your life. Platforms and data turned into intelligence, and that's where we see the really interesting things that are starting to happen. It's about analyzing patterns. It's about figuring out that this is a new infrastructure. And let's be honest, it's all about large volumes of data. The only way to really turn information into intelligence is about size and volume. And we might be at the end of digital. We might be at the beginning of the era of cognitive. And we're beginning to see that because last year, one of my favorites was based on some of the research that Google has done, training retina scans into Google DeepMind and finding algorithms to understand early signs of cardiovascular and diabetes. And this turned into an FDA-approved diagnostic, the first algorithm that was basically approved by the FDA that does exactly that and does it better than any human physician could ever do. I believe this is not an anomaly. This is maybe the beginning of a new normal because intelligence and automation combined could truly revolutionize the way we think about healthcare. Automation is something that we associate with robots, that we associate with surgical robots. But today, many people say, oh my God, there's going to be a huge disruption. I love this way of looking at it. Humans today are still the best low-cost computers that we can mass produced by unskilled labor. But there's a certain timing element to that. And the idea of reskilling also in healthcare is going to become really, really core. I love what the CEO of IBM said. Maybe only 10% of the jobs would disappear, but 100% are going to change. Fundamentally, we're in an environment now that we have to build a better radar screen for the disruptive elements that are going to happen. We need a better way to experiment and to try things. We need a better way to scale up. And I call this sense, try, and scale because I think that is going to be essential to really make that happen. Better radar, better experimentation, and better way to scale it up. And I'll be very quick into what it really means in terms of the world of healthcare because in my opinion, it basically means that our old linear thinking just doesn't apply anymore. People talk about the uncertainty in many markets. We talk about the VUCA world, volatile, uncertain, complex, and ambiguous. And I love the way that this man phrased it. We have more and more unknown unknowns. And I think this is exactly where we are at this stage. As some of you know, I wrote some works on that. I wrote a book called The Day After Tomorrow, and it's really about thinking, how do we prepare for a world of the day after tomorrow that is now happening faster than ever before? What it means in terms of healthcare, very simple. We're seeing that averages don't work anymore. We're getting into an environment where people want to be treated as unique individuals. We're seeing that reactive is out and proactive is in. The same transition we saw, for example, in dentistry is now going into the world of healthcare, going from sick care to healthcare. And more we see a community of trust. One of my favorite apps, Giant, was a chatbot environment where during the outbreak of Zika in South America, people were more comfortable talking to a chatbot than talking to a real physical human being. So what it means in healthcare is very simple. What we know about our bodies is fundamentally about to change. Look at the debacle. 23andMe ran into the huge trouble with the FDA, and when they resurfaced, actually they were almost sidetracked by the new developments. Helix, a spinoff from Illumina, now does full human genome sequencing for less than $1,000. But how do you make sense of all that data? Well, there are startups like Genome Medical doing exactly that. But of course, DNA is not the only thing. Absolutely. Look at Ubiome, which is doing the same thing, but not in your own DNA, but the 90% DNA in your body that is not your own. Fundamentally, we're going to know more about our bodies than ever before. Number two, what we measure. Look at the Apple Health Kit. They are turning it into a powerful mechanism and platform to think about medical research going forward. And then we have to really reflect on what it means to act upon that. We have to reinvent that world of healthcare for the individual. We have to reinvent it with patient centricity really at the heart. And we do a lot of visits to a company called Omada, which is a great example of focusing on diabetes, focusing on obesity, and figuring out how to use digital and actually outperforming the best performing drugs with just a digital mechanism, and then having the largest basic clinical trial of obesity in the US. And it really means one thing: we have to completely rethink what we do in terms of treatment. What we know is going to change what we measure, how we act, and how we treat. And if you put that into perspective, one thing is very clear. Yeah, we're going to see these changes not just in healthcare, but in care in general. Look at the bigger picture of care and not just healthcare, the way we age. If you look at aging today, we might be the last generation that has to take our keys away from our parents because they will use technology to live longer and better. They will have hearing aids that are going to be superpowers because they will hear better than any young person. We will have exoskeletons used in industry today that are going to be used for old people, and maybe in a few years, a 93-year-old man is going to lift your car to change the tire because they will be able to do that. How we age is going to change tremendously. How we monitor. I love this example. Connected devices, pill bottles that know when they're lifted up, when something is taken out, and think about what that could do to really adherence in terms of healthcare. And the bigger picture of using technology in care, how we're going to use that. And in some geographies, Japan is notorious, they would rather use robots than non-Japanese to think about care going forward. And finally, it means that the connectivity we will have with patients, with care all around the world, and that day after tomorrow is fundamentally going to be. So let me wrap up. We're in a world where innovation no longer is a luxury. And when you think about disruption, the reality is that innovation has to be turned into something practical. And of course, product innovation is that we often think about. We're going to see an avalanche of technologies that are going to be coming from the IT world and putting that into perspective. One of our favorites is Pillow, for example, a personal robot that is capable of understanding who you are and putting something simple like facial recognition into the context of seeing who needs to be taking their medication. It's a pill dispensing mechanism. They see who needs to take their medication. And not only do they use facial recognition, they can see the patient, they dispense the medication, they see exactly who takes the medication, and they're absolutely sure that they actually even swallowed it. Brilliant. We're going to see a lot of product innovation. At the same time, we're going to see market innovation. Look at Illumina getting into Helix. Look at the nutrition getting into nutrition as medicine. Look at insurance companies getting into the world of healthcare. And again, in Asia, we're seeing that quite strongly. The easiest will be service innovation, using technology to actually change the connection to patients and figuring out how to really enable that. And finally, the big model is going to change. We're at the threshold of some of the fundamental changes in healthcare, and that will be something that we have to prepare for and figure out that if the world of biology is going to go through the same mechanisms as we saw in computer science, that is going to be the what of how we have to tackle disruption and innovation. If you want to reinvent yourself, there is, of course, not just the what, there's the how as well. And I have to be brief, but radar, experimenting and scaling, sense, try, scale, and then run that. And many companies don't have that upper part of that hourglass model. In conclusion, you need to think about this healthcare change and figure out what your sense of urgency is, have a clear vision what you want to achieve, have the right mindset, the right direction, and of course the mechanism to scale that up. If you don't have that sense of urgency, it's all talk, no action. Without the clear vision, you're going to hit the wall. Without the right mindset, panic sets in, and without the right direction, it's basically anarchy. But without the mechanisms to scale it up, you will frustrate and demotivate the one percenters, the people who really want to move the needle even more. Fundamentally, you need all of that to achieve results. In a world where almost every single sector is being affected, healthcare is not an anomaly. Healthcare is going to follow exactly the same recipe. Is technology changing business? At the same time, technology is changing society. Extremely exciting to think about what that means. I would like to conclude with also giving you a little bit of a shout out for our Healthcare Disruption Tour, which is this year going to happen on the 25th, 26th, and the 27th of March 2019 in Silicon Valley. This is our fourth Healthcare Disruption Tour. Any more information about this, please check out www.healthcaredisruption.com. I hope to see you there, and I hope you enjoyed our little podcast about the day after tomorrow in healthcare. Thank you very much.